Hello guys, am I clearly audible and visible to you? Let me know in the chat box. I'm waiting for your response in the chat box. Let me know in the chat box, am I clearly audible and visible to you? Yeah, I think I'm clearly audible on my second screen. It seems I'm clearly audible. Visible is clarity. Just let me know about the audio. I think it seems perfect. Am I clearly audible and visible? Perfect, perfect. So this will be the session for the ENT part 2, where we'll talking about the all the important questions which is probably come to in your exams. And if you have any doubts in any particular topics, you can mention me in the chat box. So we're going to cover that particular topic also, right? It will be going to help you on the your FMG exam on the 12th January 2025, right? Yes, we're going to cover up mostly we have the part 1 also ENT, which is already uploaded there. You can watch that also. And part 2 will be going to cover up today, right? Let's start the session, okay? Let's start the session. Okay. So uh, we're starting with the part 2 of the ENT. And in this part 2 of the ENT, we're going to start up with the first question number. So the same pattern we're going to follow up here also. Yes, doctors, we're going to follow the same pattern as we already following in the all the sessions. I will be going to show you the MCQ and you have to answer that and we'll talk about that particular topic. Okay. And more some topics are already there, which is going will I will be going to cover up in the today's session. All right. All the important images also some the X-rays are the importantly we are having here, right? We have to cover those X-rays also. Let's start the session. Okay, let's start the session, right? So starting with the session with the first one, and the question is in front of you, right? In question is in front of you guys that which of the following is the not included in the major criteria of sinusitis, diagnosis in the acute sinusitis. So options are there: fever, nasal congestion, cough, and facial fullness. Now I'm waiting for your answers, guys, in the chat box. Please try to make this sessions very interactive, so it will be much helpful, right? And seems good, right? So please try to make the sessions interactive. I'm waiting for your answers, guys. That question is in on your screen. Which of the following is not included in the major criteria of sinusitis? I'm waiting for your answers. Who guys are watching live, please try to reply. I'm waiting for your answers, guys. Okay, very good, very good, very good. Okay, so let's talk about it. Let's talk about it. What is the main about the sinusitis? They are talking about it. The acute sinusitis is the also known as your guys bacterial sinusitis, right? So in the bacterial sinusitis, what will be there? Of course, there is a not included. They ask about the not including in the major criteria. So in the major criteria, what we are including? This is the main important thing, right? So we can exclude that. So the important thing is here that fever is in the major criteria. This is the major criteria, because if an infection will be there, if the infection will be there in the sinusitis is the infection, right? And the word is added here, the sinusitis, acute sinusitis. So this acute sinusitis, there will be the, of course, there will be the your fever will be, of course, should be the present in the major criteria. Also will be there the second one, which is the nasal congestion. Of course, if you are talking about the our paranasal sinus, if I'm talking about the my paranasal sinus, so of course I have to see that there will be the nasal congestion. The nasal congestion will be also in the, your major criteria. Yes, major criteria. Of course, it should be present there as we are diagnosing with the acute sinusitis. And what about the cough? Guys, please remember this should be the answer of this question. The cough is not the major, it is your minor. Okay, why this is the minor criteria? Because the cough can be possible through the any other uh, uh, any other diseases, like maybe it is related to the morely in the you're related to the throat infections, right? Not in the sinusitis, not in the sinusitis. Rather than the facial fullness is also in the major criteria. Yes, the facial fullness is also coming into your major criteria. So the what we are seeing in this condition, guys, that in the major criteria we are including, in the major criteria we are including here about the fever and nasal congestion and the facial fullness, right? Of course, they will be going to do the CBC and other tests will be there related to your infection, as the WBC will be surely they will be going to increase, but the curve will be not the curve will be not the here the major criteria. So about the sinusitis, we have to talk about it. So types of the sinusitis, I hope you had or not, right? Just let me know in the chat box. Should we have to talk about the sinusitis? Right? Let's talk about it. Let's talk about it. So what is the answer? Answer is the cuff here, right? So answer should be the here. Cuff will be the your correct answer in this case, right? So this will be the not the major criteria. This will be not the your major criteria. Okay. Okay. Let's move forward. Let's move forward. Now we are talking about the, let's talk about the your your main important symptoms and all about your sinusitis. So if I'm talking about the sinusitis, if I'm talking about the sinusitis, so there is the important, we have to talk about the your bacterial sinusitis and your fungal sinusitis, right? So there is important which we have to talk about it, bacterial sinusitis and the fungal sinusitis. Also, there is a rhinitis is different. Please remember, in the rhinitis we have the different type of allergic rhinitis. We have the vasomotor motor rhinitis, we have the atopic rhinitis, right? We have the infective rhinitis. So in the infective rhinitis, we are talking about the your sinusitis, right? So write it down in the explanation. So let's talk about the important topic, which is your fungal sinusitis. So first of all, talking about the fungal sinusitis, I hope you have the basic of the sinuses. Let me know in the chat box. Do you know, yes or not? So let's talk about the sinuses. As you already know, the sinuses, which is the paranasal sinuses we have, which is covered the air sac, right? These are the air sacs which will be the available, right? Which will be available in the your facial region, right? This is the air sacs where will be the in the facial region, right? So this air sac will which will be there, this is known as your sinuses. This is known as your sinuses. If I'm talking about the sinuses, so we have importantly four sinuses. How many sinuses we are having, guys? The importantly, if we talk about the sinusitis, let's talk about first about the sinuses, then we'll talk about the sinusitis. So let's make the topic sinuses. So there are the totally four sinuses we have. What are the four sinus? The first we have maxillary sinus. Write it down. We have the maxillary sinus. Also, we have the ethmoidal sinus. Yes, we have the ethmoidal sinus. The third one, we have the sphenoidal sinus. We have the sphenoid sinus. And the fourth one, we have your frontal sinus. Yes. So why I write this in this manner? Because this is also the development of the sinuses. So please write it down in front of your maxillary sinus. Write it down here. This is the first sinus, right? This first sinus development. So if I'm talking about it, so out of this sinuses, which sinus is developing first? This is your maxillary sinus, and which is developing last? In development, right? This is your this is your frontal sinus, which will be going to develop into the last, right? So this is the main thing where we have of the sinus. And also some important thing which you have to talk about the sinuses. Yes, we have to talk about little bit about the sinuses. The important thing that which one is the your largest sinus. If the question is asking you about it, like which one is the your largest sinus, so let's talk about this also. So we are talking about the maxillary sinus, the first one, which is our maxillary sinus, right? Maxillary sinus. Talking about the maxillary sinus, the importantly, this is the having two important thing, that it is having your important, that it is your largest, it is having your largest sinus. And if I'm talking about the size of it, it's having near the 15 ml of each. It is having the 15 ml of each sinuses. So this is having the very important sinus. The second sinus, which is a very important, we have to talk about it, that is your ethmoid sinus. Ethmoid sinus. And what is the importance of this ethmoid sinus? This is not a big sinus. It is having the, on the ethmoidal bone, we have the very small paranasal sinus, which is known as your air cells, right? This is known as your air cells. And this air cells are in the count of 8 to 10. We have the 8 to 10. We have, if I'm talking about the counting of this air cells, we have the 8 to 10 air cells totally. And these air cells, if I'm talking about these air cells, they are asking you the MCQ on the based on this air cells. They are talking about this air cells, that which is the largest cell, largest air cell or largest ethmoidal sinus, that is known as your bulla ethmoidalis. Yes, so this is known as your bulla ethmoidalis. So we have the many sinuses. So just showing you the image of this paranasal sinus. So you will be going to understand about it. Just a minute. So you will be going to confirm about the all the sinuses I'm going to show you. Right. So I hope this image is clearly visible to you guys. This image is clearly visible to you on your screens, right? So we have this sinuses, right? So if I'm talking about it, as you can see here, we have the maxillary sinus. You can see the maxillary sinus is situated here, and this is the biggest sinus, as we talked about it, the largest sinus. Yes, so it is having the 15 ml of the area on the each side, right? So now if I'm talking about, you can see the frontal sinus is also there, and we have this phonoidal sinus on the background. But if you can see here, if I'm talking about this area, if I'm talking about this area, which is your ethmoid sinus. Which sinus is that, guys? This is your ethmoid sinus. And in this ethmoid sinus cells, can you see there, guys? It is not a big sinus. It is having a very small. It is having very small air cells are there, right? So you can see this is the having the very small air cells are there, right? Yes. Very good, doctor. We'll talk about the anterior most also. Yes, very good. These are the question which is mostly they are asking you in the exam, right? These are the only the question which they are asking you in the exam, right? Yes, very good, doctor. Very good, right? So we are talking about this only, that your this is the your anterior most. If you are talking about which is the bulla ethmoidalis, so this is your largest. So you can see over there, which is the largest cell, it seems to you here. This is your bulla ethmoidalis. But if I'm talking about it, the anterior most one, if I'm talking about it, the anterior most one, so the anterior most one, write it down here, in the air cells. If I'm talking about the anterior most, this anterior most one will be your agar nasai. agar nazi. So if we talk about in this image, can you see this one, which is the your anterior one? This anterior most one, this anterior most one is known as your agar nazi. Agar nazi. Also, you can see over there we have one below the our orbit. This one, right? This is having a smaller, but we have on the below the orbit. So you can see which is your near the orbit, and we have the below the orbit. So when we have the near the orbit, near the orbit, yes, near the eye, and that is your near the orbit is your known as your onody cell. Onodal, just a minute, onody cell. Yes, this is your onody cell, and this onody cell, this is the onody cell, and we have the one which is the below the, which we have the below the orbit. Yes, these are the some four MCQs which is importantly they are asking you related to the sinuses. Yes, doctor. Which is your the which one is the optic nerve is the, yeah, very good, near the orbit, which is near the optic nerve, which is your Haller cell. Very good, doctor. Very good, doctor. Very good. Perfect. So which is the below the orbit? Yes, we have the Haller cell. Write it down here. Haller cell. So this is about the your ethmoidal sinus, right? And what is about talking about the your other, which is the sphenoidal sinus. You can see sphenoid sinus, which is on the behind, right, little bit posterior to it, right, and it is not visible on the your the anterior surface as we are talking about it. So this is your frontal sinus, which is on the your near here, right? So this is about it. So if we get the infection in these sinuses, if you are getting the infections in this sinuses, that is known as your sinusitis, right? That is known as your sinusitis. So if we are talking about the sinusitis, we have the two type of important sinusitis. The first one, which is your fungal sinusitis. Yes, we have the fungal sinusitis. Of course, by the name only you are understanding about it that this is about the your fungus. It will, the cause will be by the your fungus. So this is the fungus if I'm talking about it. So which fungus can be caused the sinusitis in the COVID, which is the recent one. We had the one more important about the fungus sinusitis, which can maybe ask you in the your exam, guys. What is the scene? Which type of the fungal sinusitis should be seen in the COVID? Anyone of you? Anyone of you guys can comment in the chat box. Aspergilloma? No, doctor. In the COVID, we didn't see the aspergilloma. This most common is the your aspergilloma. I understood it about it. But I'm talking about the COVID. So please write it down. In the COVID, we talked about the mucormycosis. Yes, I hope you remember the black fungus. The name was the black fungus. Yes, this was the mucormycosis, also known as the black fungus, right? This was the black fungus, which is the mucormycosis, and this mucormycosis, which will be caused by the which mucormycosis, which is caused by the your which fungus? The first, which is your mucor. By the name only, this the fungal name only is given in the disease. Mucormycosis the by the mucor, or maybe by the rhizospora, or rhizospora, right? So this can cause in the your COVID, which is the mucormycosis. And also what is especially it's about the most important, that it is most commonly seen in diabetic people. Yes, most commonly seen in the diabetes patients. Yes, why it is seen in the diabetes patient? Because there they are getting more the, yes, mucor will be there, mucormycosis there, because they will be they having the more nutrition, glucose will be the more they are finding that. So this is there, right? Now if we're talking about it, what is the importance of this mucormycosis? So please remember the importance of the mucormycosis, it is having the clinical feature. What kind of the clinical features it is having in the mucormycosis? So we have the clinical feature of the mucormycosis. The first one, that it is the known, it is causing the necrosis of the tissue. Necrosis, and due to this necrosis, there will be the blackening of the tissue. There will be seen the black tissues. Yes, there will be seen the black tissues, right? So in the necrosis, what we're going to see? Yes, this mucormycosis will be going to cause the necrosis, and due to the necrosis, we're going to see the blackening of the tissues. Also, the second thing, it is spreading very fastly. And why it is spreading very fastly? Write it down. This is spreads very fast. This spreads very fast because because it is angio invasive, right? So this is the your angio invasive. Guys, what the mean by the angio invasive? Angio means it is your, yes, it was in the COVID. There was a use of more steroid. It caused because the steroid is doing what? Steroid is doing the our immunity suppress, right? Immunosuppressant, right? Steroid is your immunosuppressant. So there is a taking the chance of this, right? So the immunity is very low in this condition, right? When the patient is took the unnecessary, they took the steroids they took. So because of that only, there was the more cases was seen. Yes, exactly, doctor. In the COVID, that's why it will be more commonly seen, right? So now, so it will be seen the angio-invasive because it is going to invade in the angios, which is your arteries, right, in the vessels, and it can be going to extend, and it will be, as it is going to very spread fast. So please remember, through the sinuses, from the sinuses, if we have the your fungal sinusitis, so it will be in the sinuses. So through the sinuses, it can spread to the orbit. So what is the spreading sites? Spreading sites. So spreading sites are the, it is having the two. I think it's not visible to you guys. I think it's hiding behind me. Yeah. So I'm writing down here. So spreading sites are here the two. The first one, which is the orbit, it extend to the orbit fastly, or it can be go to the brain, right? It can be go to the brain. So the nearby, what we have near the sinuses, so near the sinuses, guys, we are having the, so near to the sinuses, we are having what? We are having our orbit. So it can go to the vision, going to show the go to the orbit. It can be spreading to the orbit. It can spread to the eye, or maybe it can go to spreading into the brain most commonly, and also it can spread to the floor or roof of mouth, right? Roof of mouth. So these are the more common area where your, where will be your sinusitis, which can be caused, right? It can be going to spread out it, right? Also, this is about the mucormycosis, which is your fungal. Also, we have the special one, which is the most commonly seen, that is known as your aspergilloma, or also known as your aspergillosis. Yes, this is your aspergillosis. What is about the aspergillosis? This is going to cause by your aspergillus fumigates, right? Most commonly, it is caused by the aspergillus fumigate, and this is known as your, this is caused by your aspergillus fumigate, right? And this will be going to clinical feature. If I'm talking about the clinical feature of it, so what is doing to do, this aspergillus fumigate will be going to make the ball inside, right? It is making the ball of funguses, ball of funguses, and this ball of funguses will be going to in the sinuses, inside sinuses, and because of this ball of fungus, the patient is having the fullness of face, right? Patient is having the fullness of face will be going to feel there, right? As we talked about in the clinical picture. Also, as there is an infection by this fungus, of course, the fever will be there, and there will be the cough, maybe not. That's why the cough is the minor criteria. So that's why we are including the cough into the minor criteria, as we talked about in this MCQ, right? So you can see up there, right? The cough was the minor criteria, not in the major criteria. So there is the, we see the fever, facial fullness, as I already told you, the facial fullness will be going to see, and the important thing, there will be the discharge from the nose. Yes, then we'll be going to see the discharge from the nose, right? And this will be going to, this fungus ball which is there, this is also, right, this will be going to cause the, right, this fungus ball, if there will be present, this will be known as the aspergilloma. And now what should we have to do in the treatment part, guys? In the treatment part, for the diagnosis, guys, we can do the x-ray. For the aspergillus, we can do the x-ray, or we can do the rhinoscopy, right, for the making the diagnosis of it. And what should be done in the treatment part, guys? Please remember, in the treatment we have to do the excision of it. We have to do the excision of it, right? So we have to make the excision of it, and this is the treatment of your aspergillus, right? This is the treatment of the aspergillus. Just one more thing, as we talked about this too much here, so of course here we can do talk about this x-ray. This is the diagnosis for the mucormycosis, is also the x-ray. And yes, x-ray should be done, x-ray should be done, doctor, x-ray should be done. And what about the your treatment part? If I'm talking about the treatment part should be here. In the treatment part, we're going to give the medicine. In the medicine, we can give the amphotericin B, which is your liposomal amphotericin B, which is the which type one? Liposomal one. Liposomal. Right? We have the plain amphotericin B, liposomal amphotericin B. So we'll give to give the liposomal amphotericin B. Also, we're going to remove this fungus where is the situated. So it is known as your debridement, or we can write it down excision. Write it down the excision. So we have to do the excision of this area where we have the fungus is situated. So we're going to do the excision, or this excision should be done by the which surgery, which is your FESS. Yes, which is the renal surgery. You know about it. So here in the aspergillus, we're going to do the your we're going to do the we're going to do the your this, and what will be going to see in this fungal sinusitis, which is your aspergilloma x-ray, you will be going to see there in the your sinuses, there will be the fullness of something is filled inside the sinuses. You will be going to look like that. Now we have talked about your fungal sinuses. Also, we have the bacterial sinusitis, which is the topic number 2 of today. Bacterial sinusitis. Let's talk about this bacterial sinusitis also. So there, as we talked about their fungal sinusitis, so in the fungal sinusitis, we had the what is the cause of the fungal sinusitis is the fungus. Now we have to talk about the your bacterial sinusitis. So of course, the what will be the going to cause here? The cause will be your bacterias only. So here in the bacterial sinusitis, we are divided into the two part: the acute sinusitis. Write it down here. Acute one. Right, we talked about this question only. What are the causes, or what are the symptoms, major symptoms in the acute sinusitis? And in the acute sinusitis, what are the causes of it? What are the causes of it? If I'm talking about the causes, the first cause is your streptococcal pneumoniae. Streptococcal pneumoniae. and the second one, which is your your moraxella, and the third one, which is your Haemophilus influenza, right? We have the Haemophilus influenza. Write down here also, what about the chronic type of the sinusitis? In the chronic sinusitis, we have the important one, which is your all the staph one can cause the your right staph can be cause your chronic one, that are going to cause your chronic one, right? Chronic one staph, right? Now the important question which they are going to ask you, the important question which they will be going to ask you here, related to the bacterial sinusitis. In the bacterial sinusitis, which one is the most common sinus will be going to involve? Most common sinus involved in bacterial sinusitis. So please remember, here are the two different answers will be going to here answers, right? So why there are the two different answers should be here? The first, which is about the adult one, the second one, which is about the your children's, right? Which is in the child. So we have to write it down here, the two different one. The first one, which is about the your adults. The second one is the about your children's or the child. So in the adult, if I'm talking about the maxillary sinus is the most common going to involve, and in the children there will be the ethmoidal sinus, which is the most commonly going to involved in it, right? So we have the in the adults, in the adults we have the in the adults we have the maxillary sinus, and in the children's we are having the ethmoidal sinus. We have the ethmoidal sinus. So you have to remember about it. You have to remember about it, what we have to diagnose about it. So now this is the most important thing. Now we are talking about the what will be the making the diagnosis of it. So we can do the CBC, like CBC counts will be going to, of course, will be going to increase. But if for this we have to do the X-ray, or we can do the CT also. So please remember, for the sinusitis, the CT is the your investigation of the choice. Write it down here, star please, that the CT scan is the investigation choice, is investigation of the choice for the sinusitis, right? Bacterial sinusitis, of course, it can be sinusitis, bacterial sinusitis, or the maybe fungal sinusitis. In the both condition, we can do the CT. In the both of the condition, we can do the CT, right? Yes. Now for this, we have to do the different sinuses, right? We have to see there, right? And for this, we have to do the different kind of X-rays. So we're going to talk about the X-rays, which is your Waters view, Paris view, and your frontal for the doing this from the front. That is your Cordwell view, right? That is your Cordwell view. So when we are doing in the submental area, right? When we are doing the submental to occipital, right? We'll talk about this. That is known as your Waters view and Paris view, right? So in the Paris view, we are going to do the open the mouth, and in the Waters view, it will be going to close. And when we are taking from the anterior side, when we are taking the X-ray, right? So anterior to the posterior. If I'm talking about for the skull, anterior to posterior, if I'm taking, that is known as your Cardinal's view. So we'll talk about all the views. I have the X-ray slides of the X-rays. So we'll talk about those, right? We'll talk about those, no issues, right, doctors? Okay, very good. Let's talk about the next MCQ, which is in front of your screen. And in this question that we are asking, that which nerve will be going to supply in the area of ear, right? Which is supply in the area of the ear, and what it is doing, when we are doing the syringing. All right, guys, I hope you know about the syringing, right? When I'm doing the syringing for the clearing the ear wax, what it is doing, it is causing the cuffing reflex, or you can say the cuff reflex, right? It is doing the cuff reflex. So when you will be going to do the, when you will guys will be going to do the syringing on the patient, so the patient will be going to feeling the having the cuffing reflex. The patient is getting the cuffing reflex, and this is the important. This is the importance of this particular nerve. So they want to ask about this nerve, that which is the nerve which is doing the cuffing reflex. So very important MCQ, very important about the, we have to talk about the all the nerves of which is going to supply into the ear, right? So the question is also to mention that this is the particular nerve which is going to supply in the ear and causing the cuffing reflex. So we have to talk about it. So just the option are given to you here in this question. You can see over the screen. The first one, which is your lesser occipital nerve, you can see there, and the B1 is your auriculotemporal nerve, right? Auriculotemporal nerve, which is your part of fifth cranial nerve, right? Also, you have the greater auricular nerve, right? And you have the option D is your Arnold's nerve. I'm waiting for your answers in the chat box, guys. All right, I'm waiting for your answers in the chat box. Please try to reply me in the chat box, like which one is the your which one is the your nerve which is going to cause the cuffing reflex, which is going to cause the cuffing reflex, right? Very good, very good, doctors, very good. So I hope, yeah, perfect, 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 right, right, exactly. So this should be the answer, this should be your answer. The answer should be here your Arnold's nerve. And I hope you know about this. Arnold nerve is the branch of, this is the branch of your 10th cranial nerve. And which is the 10th cranial nerve? Vagus, right? So this is the vagus nerve branch, which will be going to supply in the, which will be going to supply your your inner ear, or you can say the ear, right? Maybe yes, it is mostly Arnold nerve is situated in the external ear, right? Arnold is situated into the external ear. So this will be going to supply there. Now, this Arnold nerve is getting stimulated, and this, because of it only, the patient is getting the cuffing reflex. So let's talk about the all the nerves related to the your related to the your ear. So let's talk about it one by one. So first of all, I'm going to talk about in a different manner. First of all, we're going to talk about the inner ear nerves. So if I'm talking about the inner ear nerves, guys, if I'm talking about the inner ear nerves, so inside the ear, in the inner ear, we have only and only involvement of the one nerve only. And which nerve, guys? Already you know about it. For the hearing, our eighth cranial nerve, our eighth cranial nerve, which is your vestibulocochlear nerve. This is known as a vestibulocochlear nerve. So this vestibulocochlear nerve will be going to give the three branches, further three branches inside the inner ear. And inside the inner ear, we have only the one nerve which will be going to supply you. That is your eighth cranial nerve, which is the vestibulocochlear nerve. So this is about the inner ear. Now we have to talk about the second one. One by one, we are going to do the second one, which is your middle ear. If I'm talking about the middle ear nerve supply, this nerve supply is the in the middle ear. We have, of course, we have the seventh nerve also in the middle ear, which is going to pass through there. Also, we have the ninth nerve, right? We have the seventh cranial nerve, which is going to passing through the your. This is going to passing through your lateral wall of your wall of your this middle wall of your middle ear, right? So we have the seventh cranial nerve which will be going to pass through there. And also in this we have the ninth cranial nerve also, right? So there will be the two nerves. Write it down. In the middle ear, we have the two nerves. The first one which is your seventh nerve. I hope you know about the name of it, facial nerve. And also we have the ninth cranial nerve, right? Now, in this ninth cranial nerve, the purely the full ninth cranial nerve will be not going to supply the which part of it, the part of the ninth cranial nerve which is known as your Jacobson nerve, which is known as your Jacobson's nerve. This will be going to supply, and this Jacobson nerve will be going to supply where? This Jacobson nerve will be going to supply into the tympanic plexus. Now, the important question is there. This will be going to supply. The ninth cranial nerve will be going to supply over there. This seventh cranial nerve just passes from middle ear, right? Please remember, this will be not going to supply. If we're talking about, the question is talking about the supplies, right? If the question is mentioning you about the supplies, we are not going to including the seventh cranial nerve, right? We're going to include what? We're going to include the ninth, but this will be going to just passing through from middle ear, right? This will be going to passes through from the middle ear. So this is about the seventh cranial nerve and the ninth cranial nerve. Seventh cranial nerve and the ninth cranial nerve. Now, moving forward for the next one, just one more. We have the external ear. For the external ear also we have to see. So the third one is your external ear. Ear nerve supply. Now, in the external ear, guys, we have the five nerves, right? In the external ear, we are having the five nerves, right? So, in the external ear, we are having the five special nerves. And guys, yes, you have to remember all the important five nerves. All the important five nerves you have to remember because these are very important. These are the very important. The first nerve you have to write it down. The first nerve you have to write it down, which is known as your auriculo auriculotemporal nerve, which is your branch of, please write it down, this is your branch of fifth cranial nerve. This is your branch of your fifth cranial nerve, auriculotemporal nerve. Also there we have the second one, which is known as your greater auricular. By the word auricular, you can remember the auriculotemporal nerve, and we have the greater auricular nerve. And we have the third one, which is your lesser occipital. The lesser occipital now. The fourth one, we have the auricular, we have the auricular, and which is the auricular now, which is the branch of, which is the branch of seventh cranial nerve, which sensory part of it. Yes. So in the seventh cranial nerve, we have the sensory part, which is your auricular nerve, right? Auricular. Now, the last one, which is the fifth one, we talked about it. This is the only the main question which is there, which is your Arnold's nerve. Yes, Arnold's nerve. Yes, this Arnold nerve, this is the branch of 10th cranial nerve, right? This is the branch of 10th cranial nerve, and yes, this cranial nerve only giving the what? the the cuffing reflex. Yes, this one only will be going to cause your cuffing reflex. This will be going to cause your cuffing reflex here, right? So this is the about your nerve supply. This is about your nerve supplies of your ear. Yeah, in the axonal ear, in the middle ear, and the inner ear. Axonal ear, inner ear, and the middle ear. I hope you remember this. So this is about the nerve supplies. And please remember about this cuffing reflex. This is very important about the Arnold nerves, which is the branch of. So mostly they are asking you about the question on the basis of the name of Arnold nerve, or they are going to confuse in the Jacobson nerve. So please remember the Arnold nerve is the branch of 10th cranial nerve. Jacobson nerve is the branch of your, yes, ninth cranial nerve. Ninth cranial nerve and the ninth cranial nerve and the 10th cranial nerve. This is a very important which you have to remember over there. Now, moving forward, moving forward for the next MCQ that in front of your screen. Which middle ear part, which middle ear part is also known as the attic, right? So I hope first of all you have to know about the middle ear. The first of all you have to know about the middle ear. Then only you guys can answer this. But the option is given to you here: the protympanum. Option A is protympanum. Option B is the mesotympanum. Option C is the hypotympanum. And the last one, option D, is the epitympanum. Right? So I'm waiting for your answers, guys, in the chat box. I'm waiting for your answers. Please try to reply me in the chat box. If you know answer, please try to reply. Please try to reply. If you don't know, then also try to reply. I will be going to correct you. I will be going to explain you about the all the parts of. Waiting for your answers in the chat box, guys. What is attic, guys? Attic. It's a very easy question. Very easy question, guys. No one is replying, guys. What happened? Try to reply. Try to. I'm waiting for it. Very good. Very good, doctors. Yes, exactly. So the answer is here. Yes, your answer should be here. Epitympanum. Your answer is here. Epitympanum, which is known as your attic. So epitympanum, or we can write or attic. And now, for understanding it, we have to talk about. We have to talk about the epitympanum. We have to talk about the middle ear. So let's talk about the your middle ear. If I'm talking about the middle ear, if I'm talking about the middle ear, this middle ear is having a six layers or the six boundaries. It is having the six boundaries. And what kind of the six boundaries? It's like a room. So I hope you can see over there, you have the room. Your room is also having the six boundaries. You have the floor, you have the roof, and you have the four walls on the four side. Yes or no? The same like this. The same like this. Our inner ear from the inside looking like the same. So what the inner ear is having inside it? The inner ear is having from the inside. It is having the six boundaries, the same as we have in our room. So this is what containing. This is having the roof. It is having the roof. Of course, the roof of it will be there. There will be having the floor of it. Right? It is having the floor of it, and it is having the four different boundaries. So if I'm going to draw about it, just a minute. If I'm going to draw, just I'm inserting it. If I'm going to draw about it to it, just a minute. One more we needed. So this will be the diagram which will be going to clear out you, which will be going to clearly give you an understanding of the middle ear. Like, so you can see here, this is our room. So we have the 6 layers. What we have, the 6 layer, I'm just writing down here the 6 layer. I will going to remove the first one, which you can see the posterior wall. The second one, which you can see over here, this one. This is the second one, which is the anterior most. The third one on the lateral side, or you can see the this is the inner side, or this is the from the outer external side. We have this fourth one, and the fifth one is the roof is here, and the sixth one is the floor. So you can see it is having the total 6 boundaries, right? So if I'm talking about this total 6 boundaries, so we have to understand, now we have to understand about this, like what are those parts of it. Now, for first of all, we have to talk about that if the 6 boundaries are over there, what this is having inside the it. So inside the it, our middle ear is consisting of what? It is having the content. If I'm talking about the content of it, contain of middle ear. So in the content of middle ear, we have only and only, right? In the only and only we are having the ossicles, our ossicles, which is your ear bones, and we have the air is filled there. Please remember, normally we are having the air filled cavity, which is in the middle ear, but in the infections, right? In the infections, we're going to see over there. In the infections, we'll be going to see over there what? Yes, the fluids will be going to accumulate there. The pus will be accumulated there. Some serous fluid will be going to accumulate there. So about it. Now, if I'm talking about this, if I'm talking about this, about the ossicles, we'll be going to talk about in a different MCQ. We're going to talk about in the different MCQ. Now, if I'm talking about to this, that what are the divisions of it? Now, for this understanding to it, what we did, we divided this. We divided this into the three parts. We divided into this into the three parts. The first part, which is divided like that. The second one, just a minute. Just a minute, guys. So the first one will going to divide like this. The second one will be going to divide like this. So this three areas, the first, I'm marking you here with a different color of pen. The first number area, the number 2 area, and this is number 3 area. So these are the three areas will be there. So if I'm talking about the area number 1, this is known as your epitympanum, guys. The options are which is given to you the same only. And why is the epi? Because this is the apex. It is above there, right? So we can the epitympanum. This is known as your epitympanum, or it is also known as attic. Yes, this is the only the attic. The second one, which is in the middle, it is known as your mesotympanum. This is known as the mesotympanum. And the third one, which is here, which is known as your hypotympanum. Yes. So we have the three one, which is the of the which the three areas are divided here: epitympanum, which is known as the attic; the mesotympanum, which is known as the middle part, right? Mesotympanum, right? And the hypo, which is the below to it. So this is the three layer which we are having over the our middle ear. So this is the room like of the cavity, and above one is known as the attic. The above one is known as your attic, right? So I hope you understand about this, about the attic, right? So the question is going to ask you about this only, that what is the area is known as the attic, and why this is known as the attic. This is the also the region, if I'm talking about this, because this attic will be going to attach, this attic will be going to attach uh, attach with your adductus. And what is this adductus part? This is connection between the your uh, bone, or which is the behind we are having, right? In the behind we are having the behind we are having the your facial recess. The recess will be going to there, right? And this will be the posterior part, which is your antrum, right? You know about it. There also we have the some air cells, right? Antrum on the mastoid part, right? So this is the parts of the mastoids, which is that we have the mastoidal air cells, right? We have the facial, right? Facial recess, which is your what? Facial sinuses, and also the facial air sacs, and also we have the inside the ear, we have the on the over the part of the mastoid bone we have, which is your attic. So this is the attic, or it is attic will be going to connected with the adductus, and adductus will be going to making the connection between the middle ear and the your mastoid bone. So this antrum is the part of your mastoid bone. This is the part of your mastoid bone. All right. So this is the connection between the your connection between the your adductus and your attic, right? So the antrum, please remember all the name is through the A, so that's why it is a little confusing. So please remember your antrum, which is the part of your mastoid bone, and your attic, which is the part of which is your middle ear, the your apitympanum, the same is. So this both will be going to connected with the adductus. So this is the connection is made by your adductus. The connection is made by your adductus, right? Let's move forward. Let's move forward. And now we are going to talk about the next question in front of your screens. The question number is talking about you the where is the where is the organ of Corti? Where is the organ of Corti is situated or located, right? The options are given to you. Option A in the scala media, option B in the scala tympani, option C in the scala vestibuli, and the option D in the stria vascularis. Right? So the option is given to you. Please try to reply me in the chat box, guys. I am waiting for your answers in the chat box. I'm waiting for your answers in the chat box. Very good question, guys. They are asking you about what? They are asking you about the organ of Corti. And I hope you know about it. The organ of Corti is situated inside the cochlea, right? Inside the cochlea. And this is the important, what is the role of this organ of Corti, or what is the function of this organ of Corti? If I'm talking about it, it is helping you. This will be going to helping you into the hearing. This is going to help you in the hearing, right? So this will be going to help you in the hearing, right? So in the parting of the hearing, if I'm talking about the hearing, so in the hearing, that is your organ of Corti is having a very important role. So we have to talk about it in the hearing. We have to talk about it that there will be the your in the cochleas there will be the we have the organ of Corti. So please try to reply me in the chat box. I'm waiting for your answers. Where is the location of your organ of Corti? Where is the what is the location of your organ of Corti? Any one of you guys? Try to reply me in the chat box. I'm waiting for your answers. Very good. Very good, doctors. This is situated into the your, yes, this is situated into the your in the scala media. This is situated into your where? It is situated into the scala media. And for understanding this, for the understanding this, we have to talk about the your we have to talk about your cochlea, right? So let's talk about the cochlea, which will be going to very important for you, right? So let's talk about it. If I'm talking about in the inner ear, if I'm talking about the inner ear, inside the inner ear, we have the two important functions. The first one, which is your important one, hearing. The second one, which is the balancing. Okay, for the balancing it, and that this balancing will be by the vestibules, but we have to talk about the only the hearing. So for the hearing we have the important structure, which is your cochlea. we have the cochlea. And this cochlea is having the two things. This cochlea is having covered with the bony part, which is known as the bony labyrinth. So cochlea is covered with the first, which is the bony part, which is known as your bony labyrinth. And the second one, we have inside this bony part, we have the membranous part. We have the membranous part, which is known as the membranous labyrinth. Right? So we have the bony part, which is your bony labyrinth, and the second one we have the membranous part, which is known as your membranous labyrinth. So now if I'm talking about to it in this membranous labyrinth, if I'm drawing a diagram here, so you will be going to understand very well about the cochlea. So just a minute, guys, so you will be going to understand clearly. I am creating this little bit. Yeah. So this is the, if I'm taking a cut section of the cochlea, I'm going to explain you the cut section of the cochlea. You will be going to understand about it. That what is in it. So now for understanding it in the cochlea, we have to separate it. If I'm going to draw this, it will be quite good for you for understanding it very well. Just a minute. I'm going to explain you only the things. Perfect. I hope is it clearly seen to you, right? So now you can understand about it that little bit more correction is needed. Just and this will be also the empty, so you will be going to understand. Just a minute, guys. Just I'm changing it to the no fill. Right. Very good. Now you can see here, this is the cut section of your, your membranous labyrinth. This is the cut section of your membranous labyrinth. And now I'm going to tell you what are this. So when I took this cut section, so what I find, I divided this into the three layers. What is this three layers? So write it down with the one by one, all the name of this. So the first one, which is the layer above one, this area is known as your scala. Write it down, guys, here. Scala vestibuli. Yes. So this is known as your scala vestibuli. The middle one is known as your scala media. This is known as your scala media. And the last one, which is the below one, this area is known as your scala tympani. Right? So this is known as your scala tympani. So these are the three membranes which we have divided over there. Now, in this membranous dividation, we have to make the organ of Corti. So here we have the hairy cells on the layers of scala media in the air of scala media, and this hairy cells only is the known as, this hair cells is known as only the organ of Corti. Yes, this organ of Corti, right? So this is the only your organ of Corti, which is the question is asked to you, right? So what the question is asking to you, that where is the organ of Corti is located? So your answer should be your, the organ of Corti is situated in the cochlea. Which part? Scala media. Scala media. But now we talked about all the options. Scala media is there. Scala tympani, which is the below we have. The scala vestibuli, which we have the above. But what is the main? The stria vesicularis. So let's talk about this layer. So this outer layer, this area. This is your stria. Write it down. This is your stria vesicularis. This is the stria vascularis. And what is this vascularis is doing? This is going to secrete the potassium. As the potassium is going to secreted by here, so please remember the potassium is here. Potassium will be the inside more, and that's why when the potassium is inside the more, what is the filled by here? This is filled with the endolymph. This is filled by the endolymph, and what is the? This is having the perilymph. This is having the perilymph. Of course, in the both scala, tympani, and vesicular, they have the perilymph. And in this is endolymph is filled with the potassium. So here we have the sodium, right? So the perilymph is filled with the sodium. So we have the sodium over the your scala vestibuli and the scala tympani. Rather than in the scala media, we have the endolymph, which is the more the potassium, and this potassium is secreted by which layer? This is secreted by your stria vascularis. Stria vascularis. Also, we have to talk about that the parts of this. As I told you, this is the stria vascularis. This is a triangular shape as we drawn here. So, of course, here also we have one name of this. So, this layer is known as, this layer above I'm writing, this is your Reisner's membrane. This is your Reisner's membrane. And of course, if they are talking about more about it, in the which part of scala media the organ of Corti is situated, this is at the basilar layer, right? So this is at the basilar layer. So this is the basilar layer, and in this basilar layer, we are having the situation of our organ of Corti, and the basilar layer we are having the your organ of Corti. Is it clear to you? Right? Let's little bit talk more about it, about the your organ of Corti, right? If I'm talking about the organ of Corti, what we are having, we have the three cells over inside the your organ of Corti. Just write it down the name of the cells. It will be beneficial for you. So just write it down the name of the cells. The first one, which is your inner hair cells, which is your inner hair cells. The second one, which is your outer hair cell. And the third one, which is the last one, your supporting cells. Right? So we have the inner hair cell, we have the outer hair cell, and we have the supporting cell. We have the supporting cell. So with these three cells, guys, please remember these three cells which is inside your organ of Corti. These three cells are the responsible for our hearing. And why the name of these cells are given as the hair cells? Because you can see this organ of Corti is having the hair-like projections, right? Having the hair-like projection. So these are the known as your hair cells. These are the known as your hair cells. So we have the inner hair cell and we have the outer hair cell. We have the inner hair cell and we have the outer hair cell over there, right? I hope you understand about it very briefly and very well about this. Your scala vestibuli, scala media, and scala tympani, which is the three part of your your cochlea, and the your layers of the your scala media, which is dividing it. So the separation between the scala vestibuli and the scala media is the Reisner's membrane, by the Reisner's membrane, and the dividation between the scala media and the scala tympani, this is done by your basilar membrane. And we have one more layer, which is the stria vesicularis, which is going to secrete your potassium, which will be going to secrete your potassium. All right, very good. Let's move forward. Let's move forward. We are moving forward for the next MCQ. Now, this is a question for you, and the question is asking you about that, which is the more there will be the a patient of the 17-year-old male is in the OPD, and the patient is presented with what? The patient is presented with the your ear pain. Highlight this, all the things. Clinical features: high fever, and the bulging of the tympanic membrane in the left ear. So the patient is having what? The patient is having now the three important clinical features which is mentioned there: ear pain, the first of all, high fever, and the tympanic membrane, which is what? Yes, which is the bulging of the tympanic membrane is seen over there. Now, for this conditions, what we have, they are asking that which antibiotic, they are asking you the question, which antibiotic, this is the question related to your pharmacology, which antibiotic is commonly used, and the option is given your ciprofloxacin, azithromycin, doxycycline, and amoxicillin. But first of all, for understanding this question, that I have to make the diagnosis of this patient, then only I can understand that what should be the given in the treatment. Like I can understand the antibiotic should be the name is given to you, but for these names you have to make the diagnosis of this patient. So first of all, guys, please reply me in the chat box what you guys are thinking as the diagnosis of this patient. What you guys are thinking for the this patient as the diagnosis of this, then only I will going to explain you about the any one of you. No one, no one, guys. Very good, very good, doctor, you are answering very well. Yes, sir, this is the disease of middle ear. Exactly, as this is a clearly mentioned, ear pain is there, no discharge is mentioned. So if there is a external ear is having the any disease or the tympanic membrane is ruptured over there, right, then only we can expect the diseases of external ear. But now here they didn't mention here that any disease of your, just a minute, the disease of external ear. So this is the disease of your middle ear. All right, very good. Let's talk about this disease of middle ear first of all. Then we'll be going to talk about this. So what is this disease, guys? This is the disease by the understanding of it. This is the disease of your ASOM. So what is this ASOM? What is this ASOM? I hope you know about it. This is known as your acute suppurative otitis media. So we have to talk about the acute suppurative. What is this ASOM? Acute suppurative otitis media. Now, for this for this understanding of this ASOM, acute suppurative otitis media, please understand this. The answer is only going to say you acute suppurative and then otitis media. So now what is the cause of it? What is the cause of it? For the acute suppurative otitis media, what will be going to see in this condition? That there will be the first of all, there will be going to see you the tubal occlusion. It means which is your which ET tube, station tube will be going to ET block. And how it will be ET block? Maybe due to your nasopharyngitis. It is due to by the your nasopharyngitis. And as the patient is having now the nasal, which is the nasopharyngitis, the patient is having what? The patient is having the nasopharyngitis. Due to this nasopharyngitis, now tubular block is there, and due to this tubular block, now there will be the there will be the your accumulation of the fluid. So there will be the accumulation of fluid, which is your pre-suppurative, which is your pre-suppurative condition. Now, what is happening? Due to this, now ET tube will be going to black, and the patient is having the nasopharyngitis. Now, this nasopharyngitis parasite, this the nasopharyngitis microorganism, maybe the bacteria will be there or virus. This will be going to reach through this station tube to the your ear, and this will be going to cause, right? This will be going to cause your suppuration. This will be going to cause your suppuration. What kind of suppuration? There is the fluid will be there, which is the non-infectious, but now there will be this will be going to cause this fluid will be going to change into the pus formation, or in the suppuration there will be going to change into the pus formation. Yes, this will be going to make the pus formation. Now, for this pus formation, it is not like that it will be going to start it. Now, for this acute suppurative otitis media, we have the important, we have the important, we have the important clinical features. What are those clinical feature of ASOM? If I'm talking about it, the first one, which is the fullness of ear. The patient is having the fullness, the patient is having that I have the fully ear, right? There is the fullness of the ear will be there. The secondly, if in the middle ear, now there will be the no air. As we talked about it, the normally we have what? Normally we have in the middle ear, we had filled with the air. But if there will be the no air and the fluid will be accumulated there, so this fluid will be going to cause the hearing loss. This will be going to cause the hearing loss. The third one, of course, as we had, now there will be the pain will be seen there, and this pain is the significant symptom. Please remember, this pain should be present there. If pain should be not there, this is not the ASOM. It should be can be the SOM. Serous otitis media can be also there, right? We have the serous otitis media. We'll talk about the serous otitis media in the later part. There will be the no pain will be going to seen. There will be the hearing loss will be seen. Your fullness of ear will be also seen there, but the pain will be not presented there. The pain will be not presented there. So this pain should be the significantly for the dividing our ASOM and the CSOM. Yes, for the dividing the ASOM and the CSOM, we have to see that there is a pain is in this patient, we have the symptom of pain, yes or no. If the patient is having the pain, it is going to see, it will be going to known as the your ASOM, acute suppurative otitis media. If the patient is having no pain and having the fullness of the ear and having the hearing loss, so this will be can cause your CSOM, right? Serous otitis media can be there. The serous otitis media we have to more investigate later, right? We have to investigate more over there for the your ASOM and the CSOM. Now the pain is the significant, so please write it down and make a star over here. make a star over here. That pain is very significant here. Now, this is not only the clinical feature. In the clinical feature, we have to see the tympanic membrane. In the clinical feature, when we are going to see the tympanic membrane, so what will be the otoscopic finding? Findings. In the otoscopic finding, we are having the first one. The tympanic membrane is red and congested. Red and the congested. This totally your in the otoscopic finding we have the tympanic membrane is red and the congested, and also there is the bulging of tympanic membrane is seen, because now inside the middle ear we have the fluid filled, which is the pus will be there. This inflammatory fluid will be there. This will be going to push. Yes, this will be going to push the your tympanic membrane to the outside, and this will be going to cause the your bulging of. This will be going to cause the your bulging of the tympanic membrane over there. And there in this otoscopic finding we have the two special feature, which is known as your cartwheel appearance and cartwheel appearance, and we can see over there fluid level seen. What is this fluid level? Guys, on the otoscopic when I'm seeing, it will be going to show me the fluid level, right? Fluid level will be going to seen on the otoscopic by the tympanic membrane, and of course this is the cartwheel appearance. This your tympanic membrane will be going to bulging out. It will be going to give us the appearance of, this will be going to give us the appearance of the cartwheel. This will be going to give the appearance of the cartwheel, right? So the cartwheel appearance will be in the ASOM clinically seen, right? Especially it will be going to seen in the your ASOM, and also the fluid level will be going to seen in this. Now if I'm talking about the diagnosis of it, so in the diagnosis of it, of course we have to see in the, we have to see the clinically and the otoscopic finding, through the otoscopic finding and the clinically clinically we have to make the diagnosis. But what should be done in the treatment part? So in the treatment part, of course we have to give the antibiotic, right? We have to give the antibiotics, and also with the antibiotics we have to do the nasal decongestion, because the nasal fullness will be, of course will be going to, there will be the, because there is a nasal pharyngitis will be there, so we have to give the nasal decongestion, right? And in the antibiotic we are using the most common, which is your amoxicillin. In this condition we are giving the amoxicillin, which is the most commonly used in this condition. If there will be the no relief by this, right? If no relief by antibiotics, then we have to add on here, we have to give the marings, or the, you know about it, it is known as maringotomy. Yes, maringotomy. Maringotomy should be done there, and this is the your treatment of choice of your acute suppurative otitis media. So in the case of ASOM, in the case of ASOM, we will going to find out that we have to do, we have to do the, in this case we have to do the maringotomy. So if I'm going to back to the question, if I'm going to do the back to the question again, the options are given to you guys, that ciprofloxacin, azithromycin, doxycycline and amoxicillin. So this amoxicillin should be given. So amoxicillin you can give in the dosing of, in the adult we are having the 500 mg of the amoxicillin, and nowadays we are not using the amoxicillin with this, we are using with this amoxicillin plus clavonic acid, right, which is the 125 mg, right? So this you are using the amoxiclav 625. Yes, amoxi CV. Yes, amoxi CV 625 is the DOC, drug of choice in the case of acute suppurative otitis media. Yes, Amox CV. Yes, doctor. The Amox CV is the brand name. Yes, the Amox CV is your brand name over there. Amox CV is your brand name over there. Now, now talking about the next question. Moving forward for the next question, and the next question is on your screen. The question is here, guys. A child is present with the hearing loss and having glue-like discharge in both of the ears. So the patient is having what? The patient is having the glue-like discharge from the both of the ear, and it is a child, most commonly seen in the children's, right? And this is the glue-like discharge which is getting out from this ears. So the question is asking you about which type of tympanogram is seen in this case. For understanding this MCQ, the first of all, you have to make the diagnosis of this patient, right? So first of all, you have to make the diagnosis of this patient. For making this diagnosis of this patient, as the patient only the mentioned that there is a no pain is there, right? Only the hearing loss is mentioned, and it is having the discharge from the ears. And which kind of discharge is there? This is a glue-like discharge. So of course, as the name is given, only the glue-like discharge will be there. So this is the case of what? This is the case of your glue ear. Okay, which is glue ear? Yes, this is your serous otitis media, SOM, right? Not the your acute suppurative. That is the different. This is your serous otitis media. This is your serous otitis media. Now, for this understanding this serous otitis media, first of all, we have to talk about your serous otitis media. Now, for understanding this, we have to talk about your serous otitis media. For understanding the serous otitis media, which is also known as your glue ear, right? So why this is known as glue ear? Because there is a patient is having the patient is having the discharge from the ear. It is the totally transparent and little bit sticky like the glue. So that's why the name was given as the glue ear, right? And what is the name? What is the mean of it? As we talked about in the ASOM, that we have there is a blockage in the your ET tube. And after this blockage, we have the pre-suppuration and then we have the suppurative. So in the pre-suppurative, what we talked about it, there is a fluid will be going to accumulated inside the ear. Yes, inside the middle ear we have the fluid will be accumulated there, and this fluid where there will be the no bacteria, no microorganism will be going to reach there. So if microorganisms reach there, please understand this. If microorganism is reached there, that will be going to the ASOM, acute suppurative otitis media. If there is a no microorganism, so this will be the your serous otitis media. So I can write that this is the your long standing. This is the long standing pre-suppurative condition. This is the long standing pre-suppurative condition, right? And what will be the most common cause of this serous otitis media? So if I'm talking about the causes, in the causes, we have the first of all, which is your adenoid hypertrophy, right? This adenoid hypertrophy is seen is in child most commonly, right? Adenoids. So the patient is having the adenoids over there inside the nose, right above it, and this adenoid will be going to make the hypertrophy. And due to this adenoid hypertrophy, what will be going to lead? It will be going to lead the your ET block, station tube block, right? This will be going to cause your ET tube block, which is your station tube blockage. As station tube will be going to block over there, now the secretion which is coming from your middle ear, this will be not going to drain out. And if this will be not going to drain out, this will be fluid will be going to accumulated over the inside your middle ear. Now there is a no microorganism, guys. Still, we talked about it. There is a no micro. If the microorganism will be going to reach over there, this will be going to cause as the acute suppurative. This will be known called as the acute suppurative. But still there is a no microorganisms, right? Now, then what about the adult? The nasopharyngeal. There will be the nasopharyngeal carcinoma. This is in the adults. This is also the most common cause in the adults. Now, this is also the nasopharyngeal carcinoma will be going to cause over there. The growth of this nasopharyngeal carcinoma will be your causing the station tube blockage. Station tube blockage. Now, if I'm talking about the clinical feature of it, please remember in the clinical feature of it, the patient is having the first of all hearing loss. What the patient is having? The patient is having of this condition, the patient is having the hearing loss. The importantly, he was having the hearing loss. And with the hearing loss, the secondly, it is having the fullness of ear. Fullness of ear, right? It is having the fullness of the ear. And fullness of the ear, there will be the no pain. Please remember the patient is having no pain in this condition, and of course no fever also we can write it down because this is not the infectious, so there will be the no fever. But in the acute suppurative, if I'm talking about if microorganism will be going to reach there, this pre-suppurative will be going to change into the suppurative condition, and that suppurative condition, please remember, and that suppurative condition will be going to cause the pain also and the fever also. So this pain is the most significant for the differentiating between the ASOM and the SOM and ASOM. Now, the third one in the otoscopic finding, we're going to see otoscopic finding. What will be seen in the otoscopic finding? There will be the your air bubbles are seen on tympanic membrane. So there will be the air bubbles over are will be seen on the tympanic membrane. With the air bubbles, we're going to see there there will be the your yellowish tympanic membrane which is retracted. Retracted tympanic membrane, right? Which is your retracted tympanic membrane. If we are talking about it, the what will be going to make, how will be going to make the diagnosis of this SOM? For this, we are going to see the for the your investigation of choice. We are going to do the nasopharyngoscopy. We're going to do the nasopharyngoscopy, and this nasopharyngoscopy will be revealed if either this is the adenoid hypertrophy or in adult. What we have in the adult? We have the nasopharyngeal carcinoma, right? So if the patient is having the nasopharyngeal carcinoma or the your nasopharyngeal carcinoma, or the patient is having the adenoid hypertrophy, Now, what should be the treatment of choice in this condition? Please remember, the treatment of choice in this condition, the first of all, we have to do the maryngotomy. What is the mean of maryngotomy? We have to make a cut over the tympanic membrane. What is a maryngotomy? Cut over the tympanic membrane. Also, we can add there, we can insert the government insertion. We're going to government insertion. Which is your ventilating tube. Yes, this is your ventilating tube. Yes, this is your ventilating tube. And also, if there is a children, or maybe what is the cause? The main cause is the adenoid or maybe the cancer. So in children's, we are doing the adenoidectomy. We are going to do the adenoidectomy in this condition. So this is about the yes. So this is all about your SOM. Now in this condition we are doing the nasopharyngoscopy, but also we can do the, in this condition, for the hearing loss patient, we can do the tympanogram. Yes, and also in this condition only they ask about your tympanogram. The question is asked you about the tympanogram. Now we are moving forward for the tympanogram. So the tympanogram, it will be quite easy test. You will be going to understand this very well. So if I'm talking about the tympanogram, so what is this? This tympanogram will be going to give us the situation of our tympanic membrane. So the cause of, what is the cause of this hearing loss? We have to diagnose this. For the making this diagnosis, we're going to do the tympanogram. So now the first of all, we are talking about this patient. So the patient is having what? Glue ear, SOM. We talked about this glue ear, SOM. So now talking about this tympanogram especially. So the option is given to you: type A, type B, type C, and type AD. So there are the four type of your tympanogram curves will be going to see. So this will be the tympanometry, or the tympanogram should be done in the cases of hearing loss. So this tympanogram, if I'm writing down here, this is your objective test. Yes, the patient will be going to reply in the objective test, and we are doing in the frequency of, what is the frequency here? We are going to put 220 or 226 hertz. Hertz will be there. And in this condition, in this test, we are getting a graph over there. And this graph is showing this four of it. So please remember, in this condition, we have the type B. In the SOM, we are going to see the type B curve on the serous otitis media. Now I'm going to tell you what is the type A, what is the type B, what is the type AS, and what is the type C, and what is the type B. So let's talk about it one by one. This is your tympanogram graph. Yes, so this is your tympanogram graph. So you are getting this report. On this, we have the pressure over there, and we have the here, which is your compliance. We are making a graph over here between the compliance and the pressure over it. Now, when we have this pressure over it, so we can get the type A. The first of all, when I'm talking about the type A, just write it down in the type A that this is the normally seen. Yes, normally seen, or we can say the normal patient, or we can write normal middle ear. This is the test of the middle ear only, right? So this is the normal in the middle ear. So the patient A, the type A curve will be going to seen you in the condition of, yes doctors, the type A condition will be going to seen into your normal conditions. Also, if I'm talking about now the second one, which we have the AD type, you can see over there it is more over there. So you can see the graph on the frequency, it is having more frequency graph, right? It is having the more, right? It is having the more compliance. So this more compliance is due to, because of the D is mentioned here, the AD. So please remember this D letter, and this is say A is saying the normal, but D is replying you that D is there is the disruption between the ossicles. What is there? There is a disruption of ossicles in middle ear. Yes, so in the middle ear we have the ossicles. So there is the ossicle disruptions. Yes, ossicle disruptions is there. So this ossicle disruption will be going to cause this ossicle disruption will be going to cause this giving us the type AD type of, there is a AD type of our graph. Also, we have the AS. Please remember this AS is the smaller than the normal one, which is the A, right? And this AS is representing you what? Please remember the word AS. As the D is replying to the disruption of the ossicle, so this S is giving us the otosclerosis. This is giving us the otosclerosis. This is giving us the name of otosclerosis. So by this tympanogram also we can identify the we can identify the conditions, right? Now what about the type B and type C? So you can see this is the type B. Also we are writing this type B as the flat type of curve, right? You can see this is not having anything, this is having a flatly, yes, it is not having any curve, it is flat line is there. So this flat line or this type B will be going to seen when fluid is accumulated, fluid in the middle ear. When the fluid in the middle ear, it will be going to see. So of course it will be going to seen in your SOM. Also it will be going to see in your ASOM. Of course, in the ASOM also there will be the pus will be going to accumulate it in the suppurative condition, but ASOM is the pre-suppurative. So please remember, as we make the diagnosis ASOM, because there is the patient is having the glue-like discharge, right? If there is a perforation will be seen there, so glue-like discharge will be of course through the patient. So this is the your ASOM, and also in the ASOM also will be seen. So more commonly it is seen in the serous otitis media, most commonly seen in the serous otitis. So in the serous otitis media we have the type 2. And what about this type C? Please remember this is a very important. Maybe they can ask you about the type C. Please remember this type C is your negative type. Why this is the negative type? Please remember, as you can see, this is the zero marking of the pressure will be there. You can see our curve is having the positively, it is the curving from the negative side and going to the positive side. Yes, you can see all the curves, which is the your AS, maybe A or maybe the AD. Of course, the B is the flat type of the curve, which is seen in the fluid accumulation. But what about the type C? As the type C, we are having in the whole the negative side. So you can see it is starting from the minus 400 and it will going to end into the near the minus 50. So it is a very negative side. And when we are going to see this negative side, please write it down. When the we are seeing the ET tube, your station tube is blocked. When the patient is having the ET tube blockage, so the patient is getting the type C curve, which is your negative type of curve, which is your negative type of the curve, right? So I hope you understand this thing very well, right? I hope you understand this very well. Is it clear to you? Is it clear to you guys? Very good. Now, this is about your tympanogram. This is about your tympanogram. Moving forward for the next question, which is of importance here, that identify the structure which is given in the image. So there is an image is given to you, which is a structural image is given to you, and they are asking you about that identification of this particular structure. So can you identify this structure? The option is given you the malus, incus, stapes, or the vomer, right? Yes, the bones name. Out of these three are the your ear ossicles, you know already well, right? So malus, incus, and stapes is your ear ossicles. But now they are asking you about this. Then yes, this is the correct. But which bone is it? Reply me in the chat box, guys. Which bone is it? Which bone is it? Reply me, doctors. Which bone is it? Yes, yes. This one, by the seeing this, there is the important feature which you see there. This one, which is your what? This is your foot plate. And which foot plate? Yes, this is the foot plate of stapes. Yes. So answer should be your stapes. I'm also going to show you more other images of the bones. So please remember this is your stapes, and just check out about this, the diagram of middle ear bones. So we have here the malleus, which is having the handle over it, right, on the tympanic membrane, like this, right? And then we have a bone here, which is having the incus, which is attaching your malleus to the stapes, and this stapes is going to attach, right, attached to your middle ear. So it is having this foot plate. Yes, foot plate. So please remember, these are the three ear ossicles, which is the seen in this your ear bones, right? This is your three of your ear bones. Now we are talking about some important. We will going to talking about your some important X-rays, right? For moving forward, just I'm giving you information that if you have any queries related to this sessions, you guys can contact me directly, or you can directly contact the MaduHub team, right? For contacting me, you can contact me over my Instagram, which is your dr.vaibhav Ahuja. Or if you don't using the Instagram nowadays in the exam time, so you can contact me over my Telegram channel, personal Telegram handle is the Dr. Vaibhav Ahuja, right? So there will be the no dot in the Telegram, and if you're putting the dot, that will be my Instagram handle, right? So you guys can contact me over there. If you have any doubts, you can contact me, or related to this session, if you have any queries, you can directly contact the team MaduHub also. All right, let's move forward. Now there we are talking about this, that some important x-rays are over there, which we have to talk about it, right? So important x-rays, the first important x-ray which I'm going to show you, or which I'm talking you with it, the first one, which is known as your thumb sign. And what is this in the thumb sign? In the thumb sign, you will be going to see over there, when we are having the child patient's thumb, the x-rays will be there. On the neck region, what I'm finding a thumb sign. It is looking like that someone is putting thumb like that. Okay, so this is the thumb. This is the thumb, right? So this is your thumb sign, and this is especially going to seen. Yes, this thumb sign is especially going to seen in your epiglottitis. Yes, so this thumb sign will be going to seen in your disease of epiglottitis. When your epiglottis will be going to getting inflammation, so it will be looking like as the thumb. So this thumb sign will be going to seen in the epiglottitis, right? Very good. Now talking about the next one, the next X-ray, which is your steeple sign. And what is this, guys? Your steeple sign. In this steeple sign, you can see over there, this is the steeple over it, right? And on this steeple, you can see over it, right? It is having the pencil tip sign. Also, the steeple sign, it will be going to seen in the condition of your laryngotracheal bronchitis, or it is also known as your croup, right? So this is also seen in the children. So I'm erasing it where I drawn it. Just try to understand this, right? This one, this is your steeple sign. This one is your steeple sign, right? This one is your steeple sign. I'm drawing it. You can see here this one, right? So this area is your steeple sign. Okay, so this is seen in the condition of, yes, the steeple sign is seen in the condition of your yes, this is seen into your steeple sign is seen in your croup or the laryngotracheal bronchitis. Very good. Now moving forward for the next one, which is important here, which is your Waters view and Caldwell's view and the Paris view. Now, please understand, for understanding this, please understand what is the difference between the Waters view and the Caldwell's view. The Caldwell's view is taken with the antero-posterior. Yes, when I'm taking the antero, it is from taking from the anterior side. Yes, and in this condition, what we are getting, which are taking this, we are seeing here, which here in the Caldwell's, we are seeing the frontal sinus. The important thing is here, we are seeing the frontal sinus. Okay, we are seeing the frontal sinus. And what about this, your Waters view? Please remember, this Waters view is starting from the your chin. And what is this? This is the mantle, right? So this is starting from the this your occipitomantle. So it will be like in this direction. When we are putting this patient, we are putting like this. The chin will be put it on the over the X-ray. So now, if the patient is putting the chin over there, if the patient is having putting over the chin over there, so now the putting the chin, which is the submanto occipital. This is the submanto. The patient is putting the X-ray sheet will be put it like that. The submanto occipital. If the patient is doing the opening of the mouth, so this open mouth is known as your Paris view. Yes, Paris view. Okay, and if the mouth is closed mouth will be seen in the, this will be seen in the, yes, this will be going to see in the Paris view will be the opening of the mouth. And if there is a closed mouth, that is your Waters view. Yes, Waters view, right? And in this condition, what we're going to see in the Paris, in this condition, we're going to see the all the sinuses are visible. All the sinuses are the visible in this condition. All the sinuses are visible in this condition. And if I'm talking about the Waters view, please remember, in the Waters view, all the sinuses visible except sphenoid sinus. Okay, so in this Caldwell's view, we can see the frontal sinus, right? We are doing this for the frontal sinus. In the Paris view, the mouth will be opened. This will be the, if guys, please remember, if the option is given Paris view, mark that. If option the Paris view is not given in that condition, please mark the Waters view. Please mark the Waters view. And if, please remember, and there will be, if they are asking you in the Waters view, we cannot see the sphenoidal sinus. When we are opening of the mouth in the this submental occipital condition, there will be the Paris view. There will be seen the all the sinus will be going to visible in this condition. All the sinus will be going to visible in this condition. The next image, which is the your teardrop sign, already we know about from the your ophthalmological knowledge. So this is the teardrop signing. This is the teardrop sign. It's looking like this, a tear is dropping out there, and this will be seen in the your blowout fracture. This will be going to seen in your blowout fracture. And now the important one, where the your ENT questions are coming from this particular side, more over there. And what is this, guys? Please remember, if I'm talking about it, what in this, please remember, just a minute, I'm going to show you. This is about the foreign body. This is about your foreign body in the, this is about your foreign body in the foreign body in the, I'm not finding this that particular image which I have to put for you guys. That is very important. I have to show you that particular slide for understanding that particular image of that. Yes, this one image is should be needed there. Just a minute. Yes, we are talking about this, the foreign body in the esophagus, right? We have to talk about the foreign bodies in the esophagus. If there is a question, is MCQ is given to you and they are asking you about it, the patient has had the foreign body, right? Ingested the foreign body, or the coin over will be there, right? So they are asking you about the where will be the location of the foreign bodies. The must question they are asking you about it. The where is the location of the foreign bodies? The foreign body will be there. So this MCQ, this image, I have to put this image, I think, for the different slide. So this will be perfectly visible to you, and we're going to discuss in a very brief, because this question is much expected to come in your 12th January exam, into your 12th January exam. So just please remember, in the if the foreign body is in the esophagus, so in the anteroposterior, so right, in the AP view or PA view, what will be the going to see? In the PA view, you will be going to see in the coin will be fully visible. And if in this condition only, in the patient is having the esophagus, if I'm taking the lateral view, I'm just going to see the streak of, I'm just going to see the streak of the coin, right, in the esophagus condition. But if the patient is having, if the patient is having the foreign body in the airway, like in the trachea, right, and in the AP view, just I'm going to see the streak of it. And in this condition, if I'm going to see the lateral view, the full coin will be visible to me. Just I'm going to show you in this image. Just remember this. Just remember this. This is a very, very important slide for the radiological images from the ENT. And you have to remember this, the coin in the trachea and the coin in the esophagus. They are confusing you in this, but please don't be confused. Please remember the trick of one important thing. Just opposite of it, you have to remember. If the coin is in the esophagus, just remember this is the your AP view, right? And this is your lateral view of the X-ray. Yes, this is the X-ray, right? So in the AP view, what will be fine? If the full coin is visible to you like this, if the full coin is visible, this is the esophagus. If the streak of coin is visible, or the lateralization of the coin will be visible, that is your trachea, inside the trachea. And just opposite of it, will be in the lateral. What? When the coin is the esophagus, it will be seen only the laterally, just the streak of the coin will be visible. And when this coin is in the trachea, we are taking the laterally x-ray, this fully coin will be going to seen you in this condition. The full coin will be going to seen you in this condition. All right, so this is about the foreign body inside. This is about your foreign body inside the trachea, or the foreign body inside the, yes, foreign body inside the your your trachea. Yes, the full coin will be view in the food pipe, which is your, you make the mnemonic as the 3F. Yes, what is the 3F? Full coin, front view, food pipe. Yes, 3F. Very good, doctor. Very good, doctor. You're answering very well. So this will be your answer, right? So please remember the 3F will be seen in your esophagus. Okay, doctor, I'm giving you this mnemonic also. Yes. So please remember the 3F mnemonic. What is the 3F? The first, full coin, visible. In which view? Front view. Yes, in front view. You can see this one. Full coin, front view. Where will be your coin? In the food pipe. And what is the food pipe? It is your esophagus. This is the esophagus. Yes, doctor. Very good. All right. So this is a very important question for your 12th January FMG exam. I hope this they can ask you about this. Such maybe they can ask you about this question of your food pipe, or this coin in the food pipe or the trachea, or maybe they can ask you about the question of, maybe they can ask you about the question of the paranasal sinus view, which is your Waters view, Caldwell's view, and your Paris view. All right. So this is all the importance of the ENT sessions, right? Which we had covered already, the ENT part 1 uploaded on the MaduHub channel, and this ENT part 2 also, which is we are going to upload it. We took this session live now and going to upload it now after the session. So please watch this session one and part two, part one and part two, both will be very important for you. Before going to the exam, you have to cover up these important topics. If you have remembered this important topic, this will be going to help you on your upcoming 12th January FMGE exam. All right. So that's it for today. All right. And we're going to meet in the next sessions. All right. If you have any queries, you guys can contact me. I given you already my contact social media handles, and you can contact me over there also. And if you have any more query related to the such sessions, you can contact the team Madu Hub also. All right. So that's it for today. See you soon. Right. And I hope you are preparing very well, guys. And just informing you one important announcement, that you have the last final edit window is going on. All right. uh, Last final window is going on related to your documents, right? So if you have any deficiency of the documents, please upload that. Otherwise, your admit card will be not going to release, right? So please cover up this all the same, right? Sir, ophthalmology sessions, already had Doctor the ophthalmology session two, part one and part two of the sessions is already completed. That is uploaded on the Madu Hub FMG channel. You can check out there. And FMT session will be going to soon, right? FMT session is will be there. Okay. And I hope FMT session is already done on the Madu app. Guys, you can check out there. FMT session is also done, I think, right? FMT session is also done. So you can check out there uh, list of on the list of your the videos which is uploaded there, right? So you can check out there. You can check out there. Okay. Yes, we have one more session tomorrow. Yes, tomorrow we have session related to the radiology. Okay, tomorrow we have radiology session. Tomorrow same timing we'll be going to meet there 7 p.m. Right, we're going to meet this tomorrow 7 p.m. for the radiology session. We have the radiology session. Okay, doctors. Thank you so much. Right, thank you so much, and best of luck for your exam. All right, very good. Okay, goodbye, goodbye. Thank you. We'll meet tomorrow, right? The tomorrow we have the radiology session, right? Tomorrow we have the radiology session. Thank you. Thank you, doctor.